Okay, so this patient had previously been injected probably with silicone. She's had 3 attempts to remove it, suction ×2, and then this infragluteal fold incision here. None of them really work. You can see product is still staining the skin here. She's got a really solid mass right throughout here. And we're going to need to do an open incision. We need to bring our incision lower. If we make our incision high like this to get our nice hourglass figure, you're not going to get out the silicone. So she's going to look great, but she's still going to have silicone. She's going to have to have another surgery. Okay, so now I'm coming underneath the flap, getting rid of more product here that was missed from our previous 3 surgeries with somebody else.
Let me stay by your side. I could see in your eyes how I live in your mind. So let's take our time. lights in the cosmos, a sound that only you and I know, that drowns out all our fears. Forgive the past, let's take control. Together a new chapter unfolds. Stand up strong, dry your tears. Oh, I could see in your eyes. Slow down time. I could see in your
So we're done here. Again, I did the incision just above where the product was, dissected down the gluteus maximus muscle, scooted underneath the product, and removed a pretty large specimen of product, scar tissue, contaminated skin, stained skin, and then raised the buttock flap to close the incision. We got rid of the majority of the product, I'd say maybe 95, 98%. You never get rid of 100%, but much softer now. A lot of that contaminated skin is gone. So that's how we do it. Again, she had previously had liposuction here twice. Didn't really work so well for her. And she had an incision underneath the buttock here, inflamed fold, to get rid of the product in the lower portion of the buttock. That really didn't really affect the upper third and the middle third of the buttock where the product wasn't contaminated the skin. So hopefully this will be our last procedure. And now we're just going to get her in a garment now to recover her.
So what are we looking at?
So this is all silicone. Here is a silicone ball right there. Huge. Here's another little silicone ball. Just silicone everywhere. And these are these little pockets, balloons, if you will, bobas, full of silicone. Basically, it's creating foreign body reaction by making scar tissue to wall it off in an attempt to sort of sequester or halt the spread and migration of the silicone throughout your body. So this is the buttock specimen from the patient's left side, buttock specimen from the right side, and we cut through the specimen. You can see these little pockets of silicone, siliconomas, granulomas, whatever you want to call them, but basically they're just full of this product that was injected years ago. It's strewn out throughout the buttock. You can see this white scar tissue that's causing a reaction to it, anti-inflammatory response. So you can see it throughout the entire specimen here. And it's very oily, very slick, consistent with silicone. So, whatever she was told it was injected, it was not, and she had injected silicone. She's had previous surgeries to have it removed by other plastic surgeons or other surgeons, but here today we removed quite a lot of silicone for her, and hopefully that'll resolve a lot of her symptoms in terms of the skin changes here, these discolorations of the skin, the lumps and bumps underneath the skin, the scar tissue, the pain, the pressure on the nerve, the sciatica, all those symptoms hopefully get resolved now by removing the product. So if you're thinking about silicone, please don't get it. You could have consequences like this. Just, there are better, safer alternatives. Exercise, if you want interventional stuff, you can do things like injections of Sculptra, alloclay, fat transfer like a BBL, and then all the way up to buttock implants, things like that. So there are good, safe alternatives as opposed to risking it with silicone. So please don't get silicone. Thanks for watching. Please subscribe. We'll see you next time.